How are radioactive materials safely handled in brachytherapy? Imagine a treatment that delivers powerful cancer-fighting radiation directly where it's needed, with safety measures so strict they protect everyone involved. That's what happens in brachytherapy, a precise form of internal radiation therapy used for cancers like cervical and other reproductive cancers. The radioactive materials used are carefully sealed inside tiny sources such as seeds, pellets, wires, or capsules. These sealed sources prevent any leakage of radioactive material into the body, making the treatment both effective and safe. Before the procedure begins, healthcare teams follow rigorous safety protocols. Every implant is tested to ensure it doesn't leak radioactive material. If the sources come from suppliers, they often include certificates confirming they've been tested within the last 6 months. The sources are then sealed and checked again before being placed inside the patient. This process guarantees that the radioactive material remains contained and stable. The treatment facility also develops detailed procedures to limit radiation exposure to patients, staff, and visitors. A radiation safety officer uses specialized survey meters to measure radiation levels, ensuring they stay within safe limits during all stages of treatment. During the actual procedure, safety is a top priority. The surgical team conducts risk assessments to identify any potential radiation hazards. Personal protective equipment such as lead gloves, lead aprons, and dosimeters are worn by surgeons and staff to minimize exposure. Additional dosimeters are placed near the patient to monitor radiation levels continuously. The operating room is carefully surveyed for any radioactive material, especially if tissue is removed or if sources are temporarily placed during the procedure. After the operation, all waste, like gloves, linens, and surgical tools, is surveyed to confirm no radioactive contamination remains. Any tissue containing radioactive sources is stored securely in specially labeled biohazard containers. Once the treatment is complete, the handling of radioactive sources depends on the type of brachytherapy used. In high-dose rate brachytherapy, the sources are temporary and are removed after treatment, so the patient no longer emits radiation. This means family members and visitors can resume normal activities immediately, with no special precautions needed. In low-dose rate brachytherapy, the sources stay implanted for 1 to 7 days, and during this time, the patient is usually hospitalized. Visitors are advised to limit contact, especially with children and pregnant women, since radiation levels can be higher around the patient during this period. Patients are also instructed to stay in the hospital and follow safety guidelines, such as maintaining distance and limiting time spent with others. Safety precautions extend beyond the hospital stay. Patients are given clear instructions on how to protect those around them. They are told to avoid close contact with children and pregnant women, and to limit pet contact. If traveling by plane, they should carry a note from their healthcare provider to explain the presence of radioactive sources, as airport sensors might detect radiation. Patients are also educated about the importance of understanding radiation boundaries, like the 2-meter line where radiation levels are typically safe, so they can help control exposure to visitors. All these safety measures are enforced by strict regulatory standards. Healthcare facilities must follow national and international guidelines for handling radioactive materials. The radiation safety officer plays a key role in ensuring that all procedures, from source testing to waste disposal, meet safety standards. These protocols are designed to protect everyone involved, from the patient to the healthcare team and the public. In the context of treating reproductive cancers such as cervical cancer, these safety procedures are especially important. The radioactive sources are sealed and targeted precisely at the tumor, which minimizes radiation exposure to surrounding healthy tissues and reproductive organs. This targeted approach allows effective treatment while reducing the risk of radiation affecting other parts of the body or causing secondary effects. Overall, modern brachytherapy combines advanced technology with comprehensive safety protocols. These measures ensure that patients receive effective cancer treatment while keeping radiation exposure to a minimum for everyone involved. If you or someone you know is considering brachytherapy, always consult a qualified healthcare professional to understand the safety procedures specific to your treatment plan.